You know, David, when we first started working on this series, I knew pretty quickly that I wanted to devote at least one episode to young adult cancer.
Totally. It's something we both really wanted to get into.
Yeah, and honestly, for me, it was kind of for selfish reasons. I fall into that young adult age range when we're talking about cancer, which, by the way, is 15 to 39, a huge range. But I just kept hearing about more and more people being diagnosed with things like breast cancer or colon cancer at ages that felt really young to me.
Yeah, and doctors don't totally know why that's happening yet, right?
Yeah, there's a lot of research going on, and we do know some things. We're actually going to dig more into the science behind young adult cancer in another episode. By the way, this is Smarter Than Cancer, and I'm Hajar Eldas.
And I'm David Hoffman.
But David, for this episode, we're really interested in what it actually feels like to be diagnosed at this point in your life. What makes going through cancer in your teens or your 20s or 30s even different from being diagnosed later on. And so to find out more, I spoke with Cameron Colin, who's a nurse here at Roswell Park and who was also diagnosed as a young adult herself. And David, you talked with Dr. Denise Rokitka, who directs the young adult and oncofertility program here.
Yeah, and talking to her, I really got a sense that it's not just the illness. It's the timing and how everything in your life seems to be all colliding at once.
Right. And between the two of them, I think we started to understand how a diagnosis at this stage can really shift your plans in a way that's different than a diagnosis in older age. At this early stage in life, you have your career ahead of you, fertility planning, relationships, all these big life things that are still kind of all in motion. So why don't we just get into this episode then?
Let's do it.
Here's Cameron, a registered nurse here at Roswell Park.
I'm 27. I was diagnosed when I was 26. I went to my annual GYN appointment and they did a breast exam and she said, "You have a pretty large mass on your left breast. Have you noticed that?" And I was like, "No." So 2 days later, I got an ultrasound. 2 days after that, I got a biopsy. And then the following Monday, I was diagnosed with breast cancer.
Wow, and you weren't feeling any symptoms or anything like that?
Thinking back at it, so I was diagnosed at the end of April, and in January when I went to my primary doctor, I was like, I've been really tired. My acne has been really bad. I said, as silly as it sounds, I saw a TikTok that said if you have high cortisol, these can be your symptoms. And I was like, I'm checking off a lot of the boxes. Could I get my hormone levels checked? And she said it's pretty hard to check hormone levels in women because of our menstrual cycles. So she checked my thyroid panel, that all checked out. And then a few months later, they felt the mass. I probably should have pushed more. When I met with my doctor in January, she tried, but they were such general symptoms that I didn't push for more because I was like, it's winter, maybe I'm just fatigued from that. But looking back, I was sleeping 12 plus hours a day. I'd wake up, feed the dogs, go back to sleep. Wake up, eat lunch, go back to sleep. I couldn't function. That should have been more of a red flag for me.
You're so young that's probably not a diagnosis you were expecting.
I was devastated at first. I got the phone call. I cried in my sister's arms. I went and told my now fiance, cried in his arms. Went to a couple appointments, and after getting my PET scan results, doctor told me that it was stage 4 because it had metastasized to my sternum. And I cried more, and she said, "But I think you're young, you're healthy. I think you're going to respond really well to treatment. So we're going to treat you like you're stage 2, and we're going to aim for curative intent." And after that, it kind of all mellowed out, and I've been using humor a lot to cope and sharing my story. I've been very open about everything. There's hard days, of course. There are days when it's hard. My fiance and I have been together for 7 years now, and we got engaged in November. Being diagnosed with cancer put a hold on getting engaged because he wanted to propose, and then I got diagnosed, and he said, do you care if you like have your hair when we get engaged? It just put a hold on everything. I said, let's wait until I'm through treatment.
Colon cancer in particular is increasing. Breast cancer is increasing. Some of it is detection, right? So our techniques to detect breast cancer, our mammograms are better. So some of it's that. Some of it is probably our diet, probably environmental factors that we don't totally know. I don't think we entirely know.
By the time a patient gets to Dr. Denise Rokitka, they've already been diagnosed and have already set their treatment plan. So when they see her, it's really more about how they're doing emotionally and psychologically and figuring out what kind of support they need to manage.
I mean, a cancer diagnosis is always a sensitive thing. How do you approach someone, who's 30 in a different way than you would someone who's 75?
Yeah. I do have a quality of life grant for a young adult psychologist who helps patients. So we talk about emotions, but we also talk about career planning. Do you need help with any FMLA paperwork? Do you need help with talking to a school? Our psychologist will sometimes do that, talk to the college, make them understand, because some colleges are great and some are not. So we talk a lot about that sort of stuff. Physical, are you having any pain? Are there any physical symptoms we can help with? We have an acupuncturist here and an integrative medicine service.
The National Cancer Institute defines young adult cancer as a cancer diagnosed between the ages of 15 and 39, which is a huge age range. People in those years are at vastly different stages of their life, but as a whole, it's a time marked by instability and major life transitions.
So we find that the young adults struggle somewhat in things like financial toxicity, family planning. Some of patients are transitioning from college to careers and trying to manage working, paying their bills, life. But also sometimes the cancer diagnosis really puts a pause on all of those things and can make it really difficult. And then emotionally, young adults really struggle with many of the things that probably everyone struggles with, but maybe in a different way, right? So things like, why me? Why now? It's rare, right? So only 90,000 patients in the young adult years are diagnosed each year. That number is increasing over the last decade. So it's not a huge number. We know that there are millions diagnosed with cancer over 40. And so that's tricky in terms of community and support.
It feels like the unseen group, right? Because we think of grandpa getting cancer.
Yeah.
And we don't think of someone who's 25, 30, 35 getting. So it must be a shock. It must be,
For
people
sure.
aren't expecting this, right?
Right. No, young adults don't expect that diagnosis. They often have delayed diagnosis for various reasons. Sometimes it's access to care, insurance issues, but also I'm young and I'm healthy and this can't be that. It can't be that something serious. It can't be cancer. In terms of delayed diagnosis, we know it's important to keep pushing. If your primary doctor is brushing your symptoms off and you don't feel right, keep pushing because maybe something really is wrong.
Talk about that a little more, about the difficulty of getting a diagnosis.
Yeah, particularly in the 20s, probably less so in our 30s, but patients often don't have primary care doctors, so they tend to seek providers through urgent care or emergency rooms, so they don't have consistency of one person seeing them for those symptoms. But we also know that providers themselves, because cancer is rare in our 20s and 30s, they sometimes are like, okay, well, that's probably just a cold or that's just stress, we don't need to do blood work at this time. So things like that where there's just a little bit of a pushback, I think, particularly in this age group.
In fairness, it probably is a cold, right? Like the vast majority.
In most of the times, yeah. 9 times out of 10, it's going to be just a cold. Yeah, for sure.
Are there medical differences in terms of treating a younger person versus an older person?
I think there's definite considerations in terms of planning for cancer treatment and therapy, right? So if you know that a person is young and still has goals to have children, is there ways to protect the ovaries, protect the uterus? Is there chemo that maybe works as well, but doesn't have some of the other long-term side effects that are important to also think about moving forward with a young adult that may be different from somebody in their 50s or 60s?
Well, that's interesting. Yeah, if something might have an effect
Differently.
20 years from now.
Right.
If you're 80, that's not such a concern.
Right.
But if you're 30, that's a big concern.
Family planning becomes a huge concern for young people going through cancer treatment because treatment can affect fertility. And often, it's the first time a patient has to confront the question of whether they want children at all.
Describe that procedure. What does fertility preservation look like?
Yeah,
Does it work?
so for females, they usually need hormonal injections for a period of time, 10 to 14 days typically, to stimulate the ovaries to make as many eggs as possible. And then with an ultrasound, the infertility doctor will retrieve the eggs from both ovaries. So that takes about 2 weeks. And so that's another tricky timing-wise. Some patients don't have time. Particularly our leukemia and lymphoma patients don't always have time to go through that before needing to start treatment. For men, it's just semen cryopreservation, so just a sperm sample that they freeze. Yeah. But insurance doesn't cover it, so I do have a quality of life grant to help offset that cost based on financial need. Financial need shouldn't preclude you from having a family later in life.
Yeah. You know, you've just gotten this news. You're worried, like, is my life over? Am I going to be able to work again? Am I going to be able to take care of myself? Do I need to? And then, okay, let's talk about children that you don't yet have, but might someday. That's a funny...
Yeah, no, it's definitely tricky, right? Some patients are gung-ho, I'm going to be great, I'm going to get through this, and I'm going to have kids. And some are like, you know what, I just need to start treatment. I can't think about that right now. But we know from research that if you don't at least have that conversation, patients can be very angry about not having the conversation, at least not understanding what their risks are up front.
Yeah.
Right?
Well, being sterilized is a big deal.
Right. And not knowing until you're done with treatment and then you're starting to try to have a family and not knowing until that point is not emotionally okay.
My surgeon, Dr. Young, she discussed egg harvesting with me initially because of the effects of chemo on your ovaries and your uterus and everything. It's a backup plan for now. We will see when the time comes to having children if I can have my own. But she said, you're young. I think it's all gonna go smoothly and you will be able to have your own children, but we should harvest eggs just in case. So since my sister was born, she's 3 years younger than me, I have known I wanted to be a mom. So that was the hardest part to cope with, that it's gonna look a little different. I just got engaged in November, and after getting married, I was like, oh, just whenever, like, we have a kid. And I was excited to be a mom, but now there's going to be a lot more planning because I'm on meds that suppress my hormones. So I have to plan when I want to get off of them so that I can have a baby, and then I have to go back on these meds after. And I had a bilateral mastectomy, so I won't be able to breastfeed. So the future is going to look a lot different than I had always imagined. It took me a long time to cope with all of this in the aspect of becoming a mother.
I'm thinking about how lonely you maybe felt. You know, you're going through this thing at this age where none of your friends are probably going through it.
When I met with my care coordinator, they gave me a card for their young adults with breast cancer group. And she said, yeah, we have a lot of people like early 30s. And I was like, okay, but how about mid 20s? And I went to one group and I just didn't feel like I felt in, because I'm like, they all had kids already and everything. And I was like, I'm at a completely different stage in my life.
It's so much more serious than anything a kid or someone in their 20s usually
Has to deal with.
Like, I can see that creating social things, because like your friend is like, oh, my boss was really mean to me today. And you're like, yeah, okay, I might die. It's a whole different,
whole different perspective.
Yeah.
And some of our survivors will say things like, particularly if they know that they're infertile or their fertility may have been affected, it may take more to get pregnant in the future. How do you share that information? You don't share it on a first date.
Totally. That's a good question.
You know, like, when do you share that information? How do you go about that conversation?
Let's talk about that for a second. Whose business is this? You're 30 years old, you got a cancer diagnosis. Do you need to tell your coworkers? Do you need to tell your boss? Do you need to tell everyone in your family? What do you think about that?
Some people choose not to, depending on the diagnosis, right? You lose your hair, you look unwell, you may have to say something. But some of these young adult cancers, patients they have a surgery, or They go on oral medicine that helps them, but they don't look any different. But they may have side effects from those medications. They may not feel well every day. They may have fatigue. They may still have nausea. Yeah, and I think it's hard. I don't know how you decide who to tell what, but relationships in particular, I think are very tricky.
Is this a third date conversation?
Right? Is it I really like you? Maybe we should have this conversation a couple months in. I don't know. Obviously don't have a personal perspective on it. I just imagine how difficult that conversation could be.
We talk a lot about being cured or being cancer-free, being in remission. What do those things really mean? What does it really mean to be cured of cancer?
Yeah, I think that's a tricky and sometimes triggering term for people. The NCI defines survivorship as the day you're diagnosed. But I can tell you a lot of patients don't feel that way. And we struggle obviously with those terms too as providers. I usually say remission, at least until we're 10 years from therapy. But that also doesn't always mean that it's never going to come back or there are other side effects or things that you still have to worry about. So it's definitely like a tricky thing to think about and to define.
When you're diagnosed with cancer as a young adult and become cancer-free, you also have a much longer runway in survivorship. And with that comes a longer period of anxiety and a longer list of things to monitor. It can mean spending much of your life tracking your health in ways most people your age never think about. And the truth is, cancer treatment can have long-lasting effects.
It's therapy dependent. Some therapies have more toxicities long-term than others, right? So we know that like anthracyclines, for instance, can cause cardiac toxicity later in life. So those patients need more frequent echoes and EKGs to monitor their heart.
Is that a chemo drug?
Yeah. Yeah. In survivorship, we really direct kind of their follow-up care based on what they received, if they had radiation, surgery to whatever part of the body, and really guide our screening recommendations to those specific factors. We see thyroid cancer as a long-term side effect, breast cancer. So some of our patients start mammograms much earlier than anybody else. So that sort of thing where we're...
So a second cancer developing after you fought back the first one.
So typically if you look at mortality charts, morbidity and mortality charts, the first thing that's going to cause morbidity and mortality is recurrence of their original cancer. That sort of fades away at the 10-year mark, and then we see an increase in pulmonary and cardiac and secondary malignancies as the patients age.
Do people who have had cancer ever get to the point where they really feel like they don't have to think about it anymore?
Probably not. I mean, there's an ease over time, right? We know that patients, when they first finish therapy, the anxiety actually spikes for that first 6 months to a year. Most cancers are going to come back within the first couple of years. So there's some pauses and relief the further you get from it. But I don't know that it ever goes away. I think it changes you.
Can I ask where you are on your journey now?
I am done with treatment. I completed radiation in January. I rang the bell after the radiation. I get a PET scan in the beginning of July, so we'll see from there.
That's amazing. Congratulations. How would you say that the cancer journey changed you?
I think maybe a little for me because it's scary getting diagnosed with stage 4 cancer, and I kind of opened up more. Like I was very reserved. I have 2 dogs, so I'm like, oh, I can't go out. I have to stay home with the dogs. But now I am much more like apt to say yes to plans and making each day count. When I was in 10th grade, my Uncle Jeff passed away from brain cancer, and his motto was make each day count. And I wanted to adapt that into my own life, but I never really did. I was young, so there wasn't much to make count, but definitely like take every opportunity, make each day count, like build good, strong relationships. It has made me put more work into relationships.
Thanks for listening to Smarter Than Cancer, a production of Roswell Park Comprehensive Cancer Center.
The show is written and produced by your hosts, Hajar and David Hoffman.
Production oversight by Peter Sosha.
Additional logistics and support from Michelle Eisenstein.
Our production partner for this series is Citizen.
Post-production by Gregory Schweitzer for DCP Entertainment.
Publication and promotion supervised by Candice Chanteloup. If you or your loved one has been diagnosed with cancer and would like to schedule an appointment with Roswell Park, please call 1-800-ROSWELL. That's 1-800-ROSWELL. Or visit us at roswellpark.org.
If you're enjoying this series, we'd love to hear from you. Please reach out and tell us about your cancer story, and let us know what topics you'd like us to cover in future episodes by filling out the form at roswellpark.org.
And if you know someone else who might find value in what we're doing, please tell them about it. You can listen and subscribe wherever you get your podcasts.